Hi, a pleasant good day to you. My name is Dr. Karen Danvers Perez, and today we're back again with definitions that you will commonly see in maternity, and this is part two. So just a reminder that these videos and all my videos are for educational purposes only. I am not a medical doctor. I'm a doctor of nursing practice. So let's get into it. So first terminology is oral contraceptive. The word oral means mouth. So you know that this contraceptive will be taken via mouth. So this is commonly known as birth control or simple the pill. They are pharmaceutical medications designed to prevent pregnancy. And as I said, they're taken orally by mouth. They contain hormones that regulates a woman's reproductive system and inhibits ovulation. So in my prior video, I spoke about, or part one, I spoke about the role that ovulation plays in pregnancy. No ovulation means no pregnancy. So if someone is taking an oral contraceptive to inhibit ovulation, then they're trying to stop the release of the egg, which hence decrease the risk of someone getting pregnant. So there are two types of pill. There is one, the progestin pill, which these pills contain only progestin and are typically used by women who cannot take estrogen for medical reasons. And progestin pill only work primarily on thickening the cervical mucus and partially inhibiting ovulation. Now the next pill, as noted, is our combination pill. This pill contains two hormones, estrogen and progestin. And the combination pill works by suppressing ovulation, thickening the cervical mucus, and making it difficult for the sperms to reach the egg. The next terminology is ultrasonography. So this is commonly known as ultrasound. It is a medical imaging technique that uses high frequency sound waves to create real images of the inside of the body. So this is non-invasive and it is safe diagnostic tool used for various medical purposes, and this includes pregnancy. So a woman who's pregnant may do an ultrasound or will do an ultrasound. They have vaginal ultrasound and they have also the external abdominal. And when I said vaginal, where they will insert a probe into the vagina to do an ultrasound, and they also have the external one, which is noted here. The ultrasound can give information such as how many fetus, is it a single fetus, is it a twin, a triplet, and it can give various information. But just keep in mind that an ultrasound is not only done for pregnant women, it can be done to look at the breast. It can be done to look at internal organs and different diagnoses, okay? So the next terminology is tubal ligation. So this refers to getting one tube tied, and I'm sure you've heard this terminology before, tube tying. So it's a surgical procedure for permanent female sterilization. So it is a method of contraception that involves closing or blocking the fallopian tube, preventing the egg from traveling from the ovaries to the uterus and effectively making it extremely unlikely for a woman to become pregnant. So let's look at this. So this is our fallopian tube. This is our ovaries. Our ovaries is what releases the egg. And as the egg is released, it is fertilized about this area. And then it goes in, it travels up, and then goes and then implants in the uterus. This is how the sperms travel. The sperms is ejaculated in the vagina. It goes up into the uterus. And then remember, it meets the egg right here to be fertilized. Now, if we have a tubal ligation where it is either cauterized or it is cut and tie or it is banded or clipped, that means the sperms cannot go up to fertilize the egg. Hence, this is one of the most effective way of preventing pregnancy. So it's called tubal ligation. Some people call it tube tying. All right. Surrogate, another terminology. So in the context of woman reproduction, it is a woman who carries and gives birth to a child on behalf of another individual. So let's look at this picture. So you can see that this lady just gave birth, but apparently it seems as if she gave birth for this couple. So she, this woman in the middle, is a woman who carries the baby, give birth to the baby on behalf of this couple here. It's called surrogate. So this arrangement is known as surrogacy, and it can be used by individuals or couple who are unable to conceive or carry pregnancy to term on their own due to medical or fertility or other reasons. The next word is fertilization. So fertilization in the context of human reproduction, and I say human reproduction because you have fertilization as it relates to agriculture, all right? So fertilization as it relates to human reproduction is a process by which a sperm cell from a male and an egg ovum from a female combine to form a fertilized egg, also known as zygote. So let's look at this. I know a slide or two ago I told you how the sperms travel through the vagina, into the uterus, into the fallopian tube, and it is around here after the ovaries, this is the ovary, releases the egg, the sperms come and then will penetrate the egg. And most of the time, one sperms penetrate one egg, all right? And sometimes when you have twin, that's another discussion. We'll discuss that at another time. But it's mostly commonly where you have one sperm fertilizing one egg. So what's fertilization? Fertilization is a process by which a sperm cell from a male and an egg, which is an ovum from a female, combine to form a fertilized egg. So this is where you have the sperms connecting with the egg, then it becomes fertilized. And just to add, after it's fertilized, then it will travel through the fallopian tube and then attach somewhere in the uterus. All right? The next terminology is endometrial ablation. So endometrial ablation is a medical procedure used to treat certain gynecological conditions, particularly heavy menstrual bleeding. So the procedure is performed to remove or to destroy the endometrial lining of the uterus with the goal of reducing or eliminating menstrual period. So this can lead to a significant improvement in the person's quality of life by relieving the symptoms associated with heavy period. So let's look at this. So as noted in this diagram, this is the body of the uterus. This device, which is called the roller ball type, which is a resectroscope, which is used to scrape the lining, in a sense, of the uterus. All right. So in a nutshell, endometrial ablation is used to treat heavy menstrual bleeding. Okay. So the next terminology is hysterectomy. So a hysterectomy is a surgical procedure that involves the removal of the uterus, which is the organ where the fetus developed during pregnancy. So remember, I showed you early on where you have the ovaries releasing the egg in the fallopian tube. After it's released and it's fertilized, that means the sperm and the egg come together, or the egg is penetrated by the sperms, then it travels and then it is placed or lodged or implanted in the uterus, okay? So this is where the fetus develop and grow during pregnancy. So in some cases, and hysterectomy may also involve removal of other adjacent reproductive organs such as the cervix, the ovaries, the fallopian tube, depending on the particular circumstances. So let's look. So you can see this is the uterus right here. In a partial hysterectomy, they remove the fundus and the upper part. In a total hysterectomy, they remove the entire uterus. Here we have a radical hysterectomy where they remove the entire uterus, they remove the fallopian tube, they remove the ovaries, and in addition, it could also include removal of the vagina too. All right. So hysterectomy is a surgical procedure that involves removing the uterus. But keep in mind that sometimes it may include removing only the uterus. Sometimes they remove the fallopian tube also, as noted here, or they may remove the ovaries and also the vagina. Premenstrual syndrome. So premenstrual syndrome, referred to as a collection of physical, emotional, and psychological symptoms that many women experience in the days or weeks leading up to their menstrual period. And it's called PMS. So PMS is a common condition that affects people or women of reproductive age, typically occurring in the 2 weeks before the menstrual and often improve shortly after the period begins. So again, this is a collection of psychological, emotional, and even physical symptoms that they may experience. So for physical symptoms, it may include breast tenderness. So before the period comes, they may feel that the breast getting tender. They may have abdominal bloating, fatigue, low energy, joint or muscle pain, sleep disturbance. For emotional and psychological symptoms, they may have mood swings, irritability, anxiety or tension, depression or feeling of sadness, difficulty concentrating, crying spells, and even social withdrawal. So those are some of the things that comes with PMS. Luteal phase. So the luteal phase is one of the two main phases of menstrual cycle in female, with the other phase being the follicular phase. And we spoke about that in our video part 1. So these phases are characterized by distinct hormonal and physiological changes that occur within the female reproductive system as part of the menstrual cycle. So the luteal phase follow the follicular phase. So here is the follicular phase. We said that day 1 starts when the woman period begins. That's day 1. Around day 14, give or take 1 or 2 days before or after day 14, this is the ovulation stage. This is where the egg, the ovaries releases the egg, and the woman is more likely to get pregnant during that time. So the luteal phase follows the follicular phase, as I said, and it occurs after ovulation, which is the release of the mature egg from the ovaries. So the luteal phase typically lasts for about 10 to 16 days, although the exact duration will vary depending on the woman, because remember that the average menstrual cycle is 28 days, but it may differ for different women, but that's the average. So the next word is lactational amenorrhea. And I'm going to put a plug here. Whenever you see A, like asymptomatic, amenorrhea, A mean not or no. No period or not period. All right? So I know that kind of sounds funny, but whenever you see A in front of a word, asymptomatic mean not symptoms or no symptoms. amenorrhea, not period or no period. So, lactation amenorrhea refers to the temporary absence of menstrual experienced by some women during the period of exclusive breastfeeding. So, this natural form of contraception occur as a result of hormonal changes associated with breastfeeding, particularly the hormone prolactin. All right. So prolactin production. So when a woman breastfeeds her infant, her body produces a hormone called prolactin. The prolactin stimulates the mammary gland to produce milk, and it has an additional effect to suppress the release of other hormones such as luteinizing hormone and follicle stimulating hormones. So, luteinizing hormone and follicle stimulating hormones are essential for maturation to release the egg. And we say releasing the egg from the ovaries, that is called ovulation. So, if prolactin reduce FSH, which is follicle stimulating hormone, and LH, which is luteinizing hormone, which is responsible for releasing the egg, but yet still prolactin reduces that, hence reducing the chance of getting pregnant, right? Symptom thermal method. So symptom thermal method is a natural family planning method that relies on tracking and interpreting various physical and physiological changes within a woman's body to determine her fertility and non-fertility phase within her menstrual cycle. So it combines the observation of multiple fertility signs to increase accuracy in predicting ovulation and fertility. So this method is primarily used by couples who are looking to achieve or avoid pregnancy without using any hormonal contraceptive or barrier method. So let's discuss this a little bit further. The couple could either want to get pregnant and they want to have intercourse during that precise time, so they're tracking the symptoms that are associated with ovulation. Or it could be a couple who don't want to get pregnant, and so they're trying to avoid having sex during that time, so they're tracking the symptoms or signs and symptoms of ovulation. So let's talk about some of the method that they could use during this time. They could use basal body temperature. This involves measuring the woman's body temperature at rest, usually when the woman wake up first thing in the morning. Using the basal body temperature, there is a slightly raise in temperature during ovulation. All right. So you have basal body temperature increasing slightly during ovulation. All right. And this is due to the influence of progesterone. So tracking the temperature change can help identify the fertility window. Another thing is the cervical mucus observation. So the method involves observing changes in the consistency in the appearance of the cervical mucus throughout the menstrual cycle. So as the woman approaches ovulation, her cervical mucus typically become more clearer, stretchy, slippery, resembling a raw egg white. All right. So if the woman, there's another way if the woman wants to know if she's ovulating, is that it's not just during the 14 days that she will start testing it. She will start looking at it throughout her menstrual cycle period, so that she can have, and I'm not talking through the bleeding time, I'm talking about after the bleeding time. She'll be able to tell as the cervical mucus changes. And again, what will it look like when a woman is ovulating? It will be more clearer, stretchy, slipperier. It will resemble the raw egg white. cervical position. So some practitioner of symptom thermal method also track changes in the cervical position, the texture, the openness. So the cervix undergo changes during menstrual cycle, and these changes can provide additional information about fertility. For the cervical position, this will be more done by a practitioner versus the person themselves. For the temperature, for the mucus check, yes, the person can do that at home. But when we're talking about the cervical position, that would be most likely a practitioner. Another thing that the woman can do or the couple can do is the calendar charting. Keep a menstrual cycle calendar to track the start and the end of the menstrual period and noting other fertility signs. Because remember, I told you that ovulation starts on the 14 days. It may differ for each woman, give or take 1 or 2 days. So all these methods combined, the calendar, the cervical mucus, the temperature, all can be used to determine the ovulation period for the woman, either to increase her chance of getting pregnant or to reduce her chance of getting pregnant. All right, so that is called the symptothermal method. The next terminology is vaginal ring. So vaginal ring, also known as a contraceptive vaginal ring or a birth control ring, is a small, flexible, and often transparent device that is inserted into the vagina to provide contraception. And again, this does not prevent against STIs or STDs. This ring contains hormones that are slowly released into the vagina lining and absorbed into the bloodstream, thereby preventing pregnancy. So it offers an effective and convenient method of birth control for some people. Because not one size fits all. There are different types of birth control for different individuals. Vasectomy. Vasectomy is like the same as the tubal ligation, or the vasectomy is to what women will call the tubal ligation. Okay, so vasectomy is a surgical procedure for permanent male sterilization or contraception, just as how the tubal ligation is a surgical procedure for permanent female sterilization. So it involves cutting or sealing of the vas deferens, which is a tube that carries the sperms from the testicle to the urethra where they are ejaculated during sex. So by blocking the vas deferens, a vasectomy prevents sperms from being released into the semen, thereby blocking it, extremely unlikely for a man to father a child. So here's the vas deferens. This is where the mature sperms go up to be ejaculated through the urethra. So it will be tied, it will be cauterized, it will be blocked off so the sperms cannot go up. One of the most common questions I've heard students ask me, so can a man still get a woman pregnant? According to the books, according to the researchers, they say that the man needs to have up to 36 ejaculations to clear the vas deferens so that there's no sperms. All right? Because even though it is cut or surgically or permanently sterilized, you may still have some sperms. You may still have some sperms in the vas deferens up top here. All right? In rare cases, sometimes it's reconnected. And if you watch those judge show about am I the father or not, and the man is saying, hey, I have a vasectomy, I can't get anybody pregnant, and then when the result comes, ta-da, you're the dad. So sometimes it can be spontaneously reconnected without even doing a surgical procedure. Transdermal patch. So a transdermal patch is a pharmaceutical delivery system that deliver medication into the bloodstream through the skin. Transdermal, dermal meaning skin. So these patches are designed to adhere to the skin surface and slowly release a specific dose of medication over extended period of time. Now, yes, we're talking maternity, so you do have contraceptive that is in the form of transdermal patches. But keep in mind that there are other medications too, not only contraceptive, that is used in the form of transdermal. So they're often used for continuous and controlled delivery of medication, offering alternative to oral medication or injection. So just remember that when the woman take before applying a second patch, the old patch needs to be removed first. All right. So transdermal patch. Dysmenorrhea. So dysmenorrhea is a medical term used to describe painful menstrual, especially the cramping and lower abdominal discomfort that many women experience before or during their menstrual period. So it is one of the most common gynecological complaints among women who menstruate. So again, dysmenorrhea is described as painful menstrual, specifically cramping and lower abdominal discomfort. Thank you so much for watching. We're at the end of the video. Stay tuned. We have about 2 more, part 3 and 4 coming up. Please, if you were informed by the video, please like and subscribe. Click the notification bell so when videos are posted, you'll be able to get the notification. Again, thank you so much for watching.